What if I told you there was a toxin floating around right now in your body that you also needed to survive? This toxin must remain within a certain range. Too low and your body has no energy to fuel the cells. Too high and you become very sick, leading to an increased risk of heart attack, stroke, or even loss of your legs. I'm Dr. Adam Goodcoff, and welcome to Your Health Explained. This is actually a very complicated topic, but the short answer is that all the glucose floating around damages the blood vessels themselves. These damaged areas become spots for plaque to form on. Plaque is essentially bad cholesterol and fat buildup within a blood vessel. Think of a dam. As the flow gets less and less, the tissue on the other side is not getting any blood flow. Eventually, that plaque will break away and clog the entire pipe. No blood flow means no oxygen. No oxygen means tissue death, and heart attacks and strokes. The other scary complication of diabetes are the amputations. You've likely heard of someone losing their toes, foot, or even their whole leg to diabetes. This is actually incorrect. Patients do not lose their limbs to diabetes, but much more often to an infection that spreads unnoticed. As sugar levels rise, the small nerves in the feet and hands get sticky. They get caked on with sugar, and the nerve signals and messages to the brain are no longer transmitted appropriately. This starts as pins and needles, or even a burning sensation, but as the damage continues, the feeling goes away altogether. What happens next is exactly how patients lose their legs. Often starting in the feet, there will be a small wound. We call this a diabetic ulcer, or a diabetic foot wound. Next up, the wound gets deeper and deeper. Again, you don't feel the pain of this wound because the nerves are no longer working. Worse even, when your blood sugar is high, you have high levels of inflammatory markers and a low ability to actually heal a wound, making everything worse. This infection finally gets so deep that it reaches the bone, a condition we call osteomyelitis. Once the infection hits bone, it can spread rapidly and often will continue to spread even with antibiotics. This leaves surgeons with only one chance to stop the infection spreading all the way up the bone into the center of the body, and that is to cut off the affected area. If you needed any more nightmare materials, these infections can also rapidly spread in the face and genital areas. Now that you are likely terrified of diabetes, I do want to offer you hope. We have fantastic treatment for diabetes in modern medicine, and you as the patient are also able to help. First is what we call lifestyle modifications. This is diet changes, increasing exercise, and even regular foot exams. All of these can not only help treat diabetes, but also prevent complications. In patients early on in their diabetes course, there are medications that can make the cells less sensitive to sugar, or even have the pancreas secrete more insulin on its own. There are also medications like Ozempic or Trulicity that can increase the production or release of insulin. Ultimately, some of these patients will not respond to these medications and may require insulin to be given via syringe. In short, sweets may not be so sweet after all. The rise in glucose and damage on your cells may not be worth the sugar high. If you enjoyed today's video and found it educational, please consider giving this video a thumbs up. Don't forget to subscribe to have your health explained.